Okay, Dr. Allison, you're on.
All right, I'm going to hit the record button if you can give me permission to record this.
Yeah.
All right. Well, thanks everyone for joining us. I'm Rob Allison. I'm a general internist in Pierce, South Dakota. I always love coming in with the big three, the American Academy of Family Practice, the pediatricians and us. We're the primary care base for the state, and we all interact real well. So it's always good to have Carlita working with us. And I want to thank the students for spending some time with us here. Who we are, American College of Physicians, there are 150,000 of us across the country in our organization. It's a national organization of which we're a state chapter, and I'm what's called the governor. I'm the person who for 4 years is the face of the chapter. We have about 400 members in the state, and they take all kinds of specialties and subspecialties to experience. So this includes our hospitalists. This includes our cardiologists, our gastroenterologists, our hepatologists, our oncologists. They're all technically come from the branch of internal medicine. And when people subspecialize out of that, that's who we are. So we use this organization as a way to bring us back and kind of bond us to the concept of what internal medicine is. We've done pretty well for ourselves nationwide. We've had some national award winners for the doctors that have come out of South Dakota. Recently, Dean Nettleman won the Woman in Medicine Award last year, and Rick Holm won the Media Award. So 2 major awards come from a small state of South Dakota. We're pretty proud of our physician providers. I'm an internist in Pierce, South Dakota. I'm born in Nebraska, trained at UNMC in Omaha, and came up to do internal medicine here in rural community. My wife's a pediatrician. Internal medicine is adult medicine. I don't take care of kids less than 15, but I go to 105. So we specialize specifically in chronic diseases, hospital-based care, and more of the adult directed measurements. But we also do primary care. In rural communities like Pierre, I do colonoscopies, I do EGDs, I do stress tests, I read echocardiogram, and I've done these for 25 years with appropriate training. And at the same time, I can send people off to our specialists so they can have the gastroenterologist or the cardiologist. We can co-manage people. I just did a stress test on a gentleman about 20 minutes ago that we'll send off and discuss with our cardiology brethren. So that's kind of our role as who we are as physicians. As an organization, you know, we listen to each other as a state here. Let's see if I can share my screen here real quick here. I see it now. All right. So we routinely go and advocate for patients and healthcare for physicians in Washington, D.C. We love taking doctors from across the state. In the red dress there is Kelly Evans-Hollinger. She's our internist in Brookings. Nazia Correa is a hepatologist. We have a resident fellow now. He's a cardiologist. Prince Sethi is gone there. And we have the ever-present medical students who tend to get the most important feedback from our representatives. They really appreciate that. So we love to advocate and go and do that. National organization has a leadership conference, and that's where we take our students and where we perform those activities. Other resources that come for being a member, and again, membership is free, and that information on the slide that was above my head when we started, or also in some paperwork you can get from the staff there, talks about resources such as educational materials. MACP is a commonly used preparation for a board certification. CME, there's all kinds of podcasts like available for the AAFP. Our national meeting is very popular. This year it probably won't happen again because of the virtual COVID experience. But our state meeting will happen. It's also virtual in October 10th. And so participation in that would be fantastic if you want to join us for that virtual experience there. What we have an internal medicine interest group similar to what the AAFP has, and they're active in the process. We like to focus on important issues for those students. We're focusing on volunteerism and any kind of projects that we can get from our students to kind of expand our presence in the state is appreciated. Besides that, I think I'll open it up for questions as well. Our social media pages, as we mentioned, we're on Instagram, we're on Twitter, and we're on some variable different media platforms and how we communicate as a group. So I'll open up this for any questions at this time.
I can just add in that I will send out to you guys through email. It was also in your meeting invite, but if it's easier, there's 2 links for each group to be able to sign up for your membership. It's all free and you can do it online. I think I know Chris had indicated with the ACP to try to get it done, the sooner the better, just so they can get information out to you guys about things. So.
Yeah, in particular, like above, there's the web address for ours and the QR code. If you're a QR reader person, it might even work on your video right there. So.
Right. No, any questions at all that anyone has? All right. Well, if you guys have any questions that you think of later, I'm going to put Carlita and I'll put Chris, who helps kind of coordinate the ACP. She wasn't able to attend today, but she told me I could give her email address. So if you guys have questions or anything, feel free to contact them. So Carlita, anything else that you'd like to say?
Nope, I just welcome you all to become members of both organizations, because there's very valuable information on both websites, and the mailings that you'll get, they're not overwhelming, but yet they're helpful to what you are going to need to be utilizing for research and those types of things. So I encourage you to become members of both organizations.
All right. Well, thank you, Carlita. Thank you, Dr. Allison, for your time. And I think we'll be good for this afternoon. So.
Thanks, everybody.
All right. Thank you.